Now move on quickly into our final session of the evening. It's a panel discussion hosted by Doctors Hospital and Integra Healthcare. It's on the topic from Caymanians, locals, and expats. How does Cayman navigate personal health? This is set to be another good one. So I'd like to invite Dr. Alex Vass, a family practice doctor, holistic physician, and health and well-being coach at Integra Healthcare, Dr. Sidney Ebanks, GP and Director of the Outpatient Department at Doctors Hospital, Dr. Grant Rogers, Family Physician and Urgent Care, Occupational Health at Doctors Hospital, and Dr. Tanushree Bhakta-Perry, Family Physician and GP at Integra Healthcare, to give us their insights. We welcome you. So Mr. Mario Ebanks is going to give me a brief reprieve and help with the panel discussion. So, Mario.
Thank you and good evening, everyone. My name is Mario Ebanks. I am the Director of Human Resources at Doctors Hospital. And our discussion today, as you can see from the screen, is from Caymanians, locals, and expats. How does Cayman navigate personal health? Before I proceed with the session, I'd like to first of all recognize the minister and her team, the HSC, the organizing committee, and all the sponsors. So please give all of them a round of applause, please. So this subject is a very broad and dynamic one. It should engage our minds towards collective solutions to take healthcare in the islands from good to great. And I have a distinguished panel here from Doctors Hospital and Integra Healthcare. And being amongst them, I feel like I am in the universe of brilliance, really, in my lowly estate, and possibly second only to artificial intelligence environment. So in saying that, let me introduce the panel before us. We have Dr. Sidney Ebanks. He's a GP and Director of the OPD, Urgent Care at Doctors Hospital. Dr. Sidney is the first one to my left. Dr. Tanushree Bhakta-Perry, Family Physician and GP at Integra Healthcare, the third from my left. And the rose amongst the three thorns. Dr. Grant Rogers, Family Physician, Urgent Care and Occupational Health at Doctors Hospital, at the end, or the middle, sorry, the end, sorry. And last but not least, Dr. Alex Vass, Family Practice and Holistic Physician, and a health and wellness, well-being coach. So we want to engage the audience this afternoon as well. We know this is the only block between getting out into the traffic and going home. So we want to make it as efficient as possible. But we want to have you leave on a high note as well. So throughout this discussion, we will also be recognizing folks who want to ask a question. And there may be a little surprise for those who ask questions. If they're too hard, there's no prize. But if the questions are okay, you'll get a prize. So we have a number of topics to unpack, a number of questions to unpack. And As I said, you'll see the bios of all the panelists in the program, so we're not going to say too much about that other than what I just said. But I just want to ask a couple of questions, and then at some point we'll open it up to the floor for questions. And I want to start first with Dr. Sidney Ebanks and Dr. Rogers, because this question is one that lends itself more to people who've been here a little longer on the island. Are there any regional or Caymanian health conditions which are more prevalent, gentlemen? What are they, and have you seen any changes or trends or ailments being presented at your practice in recent years? Dr. Sidney, we'll start with you.
Thank you, Mr. Moderator. Regrettably, what we have seen is an uptick in chronic diseases. As a matter of fact, if I could draw your attention to yesterday's edition of the Caymanian Compass, the three major killers in the Cayman Islands are heart disease, stroke, and malignant neoplasms, i.e. cancers. We have seen an uptick in these things, and perhaps that is a function of better detection and better reporting, or is it just a function that we have a lot of work left to do?
Dr. Rogers?
Hi, thanks. I've been here for just under a year now again, and I must say I've seen a lot of hypertension and diabetes. Both are very prevalent here. And having dealt with quite a few patients with these issues, I think it's very important that we also look at the holistic side of medicine, especially with regards to nutrition and exercise, because these two factors can help a lot in these chronic diseases and managing them.
So, Dr. Rogers, could you tell us, and then take all the panelists coming back to my direction, tell us how your practice has changed since you arrived in Cayman or in recent years. What have been the more sort of noticeable changes?
Well, from my perspective, I'm at Doctor's Hospital in the urgent care setting, and we've got a walk-in setting as well. So it's not like a normal GP practice. We see patients that need to be seen here and now. So we are doing more, not really emergent, but urgent consultations with patients who have problems with their blood sugar or they've got hypertensive urgencies, and we normally deal with those, and we would control them, sort them out, and then refer them back to their GPs. So that is a little bit different to what I'm used to, having previously been in the general practice setting.
And Dr. Tanushree, same question to you. How has your practice changed in recent years or since you've been here?
So I think, so I've been on the island just over 2 years now, and I'm a GP from the UK. So I guess I think management of chronic diseases, things like diabetes and hypertension, like back home, we're used to this being predominantly run from our nursing colleagues in the practice clinics. Diabetes is generally managed in the community. And I think here I found that it's good to kind of go back to just general management of diabetes, hypertension, managing that myself, and I think that's one of the things that's changed. I think also I find, I think it's screening for diabetic complications, asthma complications, all of these things. It's good to have, I think we need to have a balanced kind of program, a screening program. Just say, for example, diabetes. You should be seeing your eye, having an eye check every year. You should be having a foot check every year. And I think that's a thing that definitely is needed here on the island, just because, we don't have that formal kind of diabetic review, and I'm just seeing patients who develop complications because things go unmonitored. I think that's definitely highlighted.
Thank you. Dr. Vass, you can just bring the mic down to Dr. Vass, please. Same question.
Hello, everyone. So in my practice, I think things are pretty much the same, really. The health problems faced by Cayman are pretty much the same that are faced by most Western countries: obesity, metabolic disease, cardiovascular disease, cancer, brain disease. They're all the big killers now. The old killers of infectious diseases, medicine has solved through antibiotics and antivirals, but now the big four killers, modern medicine hasn't got many answers for. And I believe that medicine is entering a new paradigm where medicine needs to think more about prevention rather than trying to treat something. And so the big problems here with cardiovascular disease and diabetes and metabolic dysfunction, I'm encouraging my patients to think about lifestyle changes that can help modify the course of their illness and even prevent it. So it seems particularly key in this country, as well as other countries, that we put more focus on prevention rather than trying to cure something. And hopefully, along with changes in governmental policies and support through public health policies, Cayman can try and approach the problems with a more preventative approach rather than a treatment approach.
Thank you. Just take the microphone and just speak directly into it, so we're live streaming globally, so I want to get all this message out. Dr. Sidney, same question to you.
Thank you, sir. When I reflect on your question, I think there are three things that one needs to bear in mind in terms of the role in which my practice has changed over the 19 years that I've been here. And it does bring us back to the question of more aggressive preventive practice. But I would say the three things that resonate with me are public expectation, information, and technological advancement have all contributed towards a change in practice. What do I mean by that? There is a higher expectation of good outcomes, and we will segue into that later, I'm sure. And the question then, burning question becomes, what is a good outcome? By whose definition is something good? We are now in the information age where patients are armed with more information than ever before, and quite often will come to you with very strongly held views, which sometimes they concur with what you have diagnosed and what you propose, and at other times they're diametrically opposed. And you have to be able to navigate that minefield with tact, diplomacy, and sympathy and compassion. The third area that I want to reflect on is a technological advancement. When I returned 19 years ago, you couldn't get an MRI scan. You had to refer a patient overseas. It's now a readily available modality of imaging. We've got rapid access to it. Okay? You can just pick up the phone now and call a radiologist and say, can you tell me what you think about this? So the practice has changed in terms of the speed of delivery of care and the standard of care and the expectation and the information. However, all that being said still shows us that we have problems with high rates of chronic disease that runs in an uncontrolled and untrammeled manner, which speaks to Dr. Vass's point that prevention needs more attention, more energy focused on it. Thank you, sir.
Thank you. I want to just pose a question to Dr. Vass then. We'll just go back to him. How do you see the whole person and their health needs? And what are, if there are any impediments to follow-up care of patients in the Cayman Islands? You take it first and I'll pass it off to Dr. Tanushree afterwards. You can just grab the microphone and speak directly into it.
Sorry, can you just repeat the question?
If I remember it. How do you see the whole person and their health needs? And are there any impediments to follow-up care that patients may have in the Cayman Islands?
If I've understood the question correctly, you're saying are people's health needs satisfied in Cayman in terms of follow-up?
Yeah, the whole person.
The whole person.
Overall, yeah.
I think, as I said, I think medicine is entering a new era where doctors need to change their practice and doctors need to be more whole person centered. So aware of somebody's physical, mental, emotional, spiritual needs rather than just purely focused on the physical. That's kind of old style medicine that the way I was trained at medical school and perhaps many of us here were trained. I think now there's a greater appreciation that the way to get somebody towards optimal health is through a whole person perspective. I think people are also expecting that more, as was already mentioned. People do see their health and well-being not just in a physical sense anymore, and they want to be cared for in a more rounded fashion. I think in terms of follow-up, I think patients are keen to be seen more regularly. I think there are insurance complications about being able to do that, but I think there's definitely capacity for patients here. They're very fortunate having lots of healthcare providers to provide them healthcare. So I think it's up to the doctors to empower the patients to educate themselves, take more charge of their health, and also advise them they are entitled to regular follow-up to allow them to progress on the journey towards better health.
You mentioned insurance complications, and I see Dr. Tanushree nodding her head. So you want to just continue with that?
So I think one of the biggest things I found, I mean, the patient will come and see me, and they've run out of their medication refills, okay, and then they'll come and see me. I'm not known to them. I don't know their history, and so we develop that relationship, and you say, we put a plan in place. Here's the medications, these are the investigations you need, the monitoring, all of that. And then generally what I found is just if there is any, if they don't have enough insurance coverage, they don't want to come back for follow-up. And I completely understand that. How is my, sometimes, I will, management of hypertensions, for example, sometimes if you start a patient on a certain medication, in the UK, we would traditionally do some blood tests like a week later to make sure, your kidney function is not going off. But I find that I won't put people on that medication because I know that they can't come back to do the investigation. So I'll put them on an alternative that is evidence-based. And, so I'm thinking about the patient's kind of whole, socio-economic kind of background when I'm doing this. But definitely insurance is a big thing. But follow-up doesn't always have to be face-to-face. It can be, I think with COVID, certainly in the UK, it revolutionized general practice. We locked everything down and we did telephone, the amount of medicine you can do over a telephone or video consult is incredible. And I think I utilize this now, for patients that I know that maybe don't have the means to come and see me face-to-face for follow-up. I'm just as long as you're following up with me in some way and I know that you're safe, then but that is the biggest
Thank you.
impediment.
Now it's time to fully engage the audience. Do we have any questions from the audience it's burning that you want to raise at this point? Don't all speak at the same time, but all right, so we'll move on.
Sorry, Mr. Moderator, I see a hand.
Oh, yes.
Thank you. I think when it comes down to responsibility of health, we have to look at the individual and maybe not necessarily look at the insurance company as being the sole responsibility to your health. And if we look at a hurricane that comes through or a storm, and it rips your roof off, then we don't always have the insurance to do that, or if your tires wear out. So what is your proposal to put the responsibility back to the patient versus always relying on insurance?
Thank you. Dr. Roger, you take that one.
Can I answer that? Yeah. Okay.
Just hold the mic close to you if possible.
Look, I think it's really important that patients take responsibility for their own conditions. It's the best way to actually manage a chronic condition. From my previous work in other countries, I'm very used to patients doing their own monitoring and chatting to them over the phone and doing follow-ups like that. And that was for other reasons, not for insurance reasons, but because we were so busy and they couldn't get appointments. But I find here that patients are very receptive to me calling them back and chatting to them about their condition. And especially if I put them on a new medication, we will discuss potential side effects. And I find that they really appreciate us just picking up the phone and chatting to them. And it also, I think, helps them just knowing that you actually are concerned and you have an interest, and that really does make a difference. That's how I'm trying to manage it, if they can't come back and see me as frequently as I would like.
Thank you. I think the gentleman who asked that question, it was not too difficult, so it qualified for a prize, so I think our marketing specialist has a prize to give you. Okay. We have another question. The lady with the, okay.
It says here, bridging the gap between patient and practitioner, pathways to optimal health. Is it possible, do you think it's possible that if this forum were to go into the community where a lot of our Caymanians are, because a lot of them won't come to this setting, that you'd be willing to go to where they are to bring this type of information so we can bridge the gap?
I'll ask the panelists to just say yes or no, starting with Dr. Sidney.
A resounding yes.
Dr. Vass? Yeah, it's habit, I think. Yeah.
Yes, I think all the panelists would agree, providing care in the community is a fantastic way of making sure people who have more barriers to accessing healthcare can get the healthcare they need, yes.
It's a long yes or no, but that's all right, that's okay. Thank you, good question. The lady with the...
Good afternoon to you, panel. This is a segue actually into what was just asked, because what I'm hearing is accessibility. And the cultural relevance is very real. I hear a lot of international perspectives, but when you look at traditional ways of accessing, that is crucial when it comes to preventative care. It's better focusing on prevention rather than the cure. So if we start the whole partnership with the social clubs, get into your Rotary, Leo's, Lions, get into the schools, look at the curriculum-based plan that the education department has. It's better to nip it in the bud before it actually starts. And if we can condition our children, then we can turn this paradigm around. It is, how do we think outside the box versus trying to reinvent things? Maybe take this to a different level, and how can we work together as a community to realize the bridging of the gap that currently exists.
Thank you. Any member wants to take that? Dr. Sidney, can you just take that and just cover it with the panel?
Thank you. I want to commend you for some of those excellent suggestions, such as the involvement with the service clubs and so forth. One of the things that we're doing right now in real time is streaming this live. This becomes immortalized on the internet. Of course, we also have to face the reality that there are people who still do not have access to that sort of modality of information, right? And if I may, getting information to stick is very much like plastering a wall. You pick up some plaster on a trowel and you fling it on the wall, some will stick, a lot will fall off, you just keep flinging it on the wall. You just have to keep sending the message over and over and over and over again.
Thank you. Question in my right.
More or less a statement. I totally agree with what the lady just said, and she had some really valid points. However, the gentleman before that asked the question, I think I interpreted it very differently to how it was answered. And I may be speaking out of turn, but the people that either have limited insurance or no insurance probably are not going to come to you. So how then do we reach those people? So I work in government schools, and a lot of parents have very limited to no insurance. So, how do we reach them? And I think it's literally by what the lady just said.
Yeah, thank you. So I want to try to capture what you're saying and what others might be thinking, and ask each of the panel members to comment on what does good look like to you in terms of a practitioner, And what does that look like, in your opinion, to the patient in terms of good service and good engagement in healthcare? Starting from Dr. Rogers.
So let me get that correct. You're asking me what I see as good and what my patients see as good.
Yeah.
So, for example, if I've got an...
in terms of healthcare delivery.
Say if I've got a middle-aged, overweight, diabetic hypertensive that I'm seeing for the first time, my interpretation of good would be able to, say, in 6 months to a year's time, to have my patient lean, eating well, exercising with a normal blood pressure and normal blood sugar. Okay, and hopefully on minimal medication. That's how I see good. Okay, so that's quite a holistic approach to everything, because I will talk to them about their nutrition, their lifestyle, and also the medication. I think sometimes patients just see good as my blood sugar's down and my blood pressure is normal, so I can carry on as before. That's what I see a lot of. And that's not all patients. There are a certain number of patients that engage completely and do change their lifestyles and change everything. So.
Thank you. Dr. Tanushree? Just keep the mic close to your mouth and concise.
So I think every patient, I think, views their definition of good is different for everyone. Like you said, like it's not just diabetics and hypertensives, like just say mental health, like, you know, a patient's version of a good outcome from a consult can be, yes, I got the medication that I wanted from the doctor, but actually my version of good is, why is it that, what are the issues, why is the patient wanting medication or some form of management, what can I do, like short-term, medium-term, longer-term goals. You know, we don't just look at the here and now. I'm trying to think of the whole person. So I think that's really important. I think we have a great, you know, there is a lot of healthcare provision here, and I think it's, you know, you can see your family doctor and you can get a specialist opinion within the same day. That's incredible. Like, is that good healthcare? Like, yes, that is good healthcare to some degree. Sometimes it can work the other way, that, you know, where patients have too much access to the specialist as well. And whereas, you know, I think as doctors, we should be giving patients the tools to help themselves. We are not the medicine. We need to be helping people empower themselves, empower their health. I think that's good healthcare, in my view.
Thank you. Dr. Vass, just get...
So yes, I'd pick up the same word as Tanushree about empowering patients. So a good healthcare system, in my view, is, you know, helping a patient become healthier and happier and living a longer and healthier life. Those outcomes are the ones I'd look for. So there's definitely the relationship between the doctor and the patient is very essential to that. But also outside the bubble of our health, the care I provide, is what the larger healthcare system is like. In terms of public health programs and systems, I don't know many policies in Cayman, but I think there'd be lots of opportunities to make big public health advances in terms of exercise and diet. I don't know if anybody saw the Blue Zones program on Netflix, but I'd love Cayman to become a new blue zone. If there's any government officials out there, I think it'd be a great opportunity to make Cayman a healthy, happy place to live.
Thank you. Dr. Ebanks?
Thank you very much. As I was reflecting on that question and the responses from my colleagues, I brought to mind again the theme of this conference, bridging the gap. Quite often, good has gaps in it. And I think that it's a rather complex question to answer. Are we speaking of good as a metric for achievement, such as good blood pressure control, control of blood sugar, getting people's weights down? Do we define good as prompt and timely delivery and affordability and access? Do we define good as a state of optimal well-being in terms of emotional, physical, spiritual, and mental health? really, what is good? And I think it's a very complicated question to answer, but I think also at the heart of what is good is how does that patient feel? There's an old aphorism that people don't care how much you know until they know how much you care. And if people feel you don't care about them, you're not good, you failed.
Yes, thank you. We've had some prizes sponsored by Doctors Hospital and Integra Health. So those who have asked questions, you've got your prizes and surprises in there as well. So any other questions from the audience? Yes, Ms. Lizette?
Hi, good evening. Just a comment really in response to the young lady's comment earlier, because I think in a forum of this nature, I think it's important that we have to share the information that's available. And the comment was whether, how do people who are uninsured or underinsured seek care? And I think we all know that the government has legislation in place that all persons living and working in the Cayman Islands should be insured. However, unfortunately, still we have about 10% of the population who are not insured, and then a large portion of the population, especially the domestic working population, that is underinsured. So the public hospital has agreements with the ministry, a purchase arrangement with the ministry, so that persons that are coming into the hospital who are uninsured or underinsured, who have mental health illnesses or elderly, children, or those with chronic illnesses can be treated, and then we assist them to apply to the needs assessment unit for more temporary or longer coverage. So persons who have illnesses can be cared for. However, there's a process that we have to go through in order to make sure that happens.
Thank you for that. Thank you. Any other questions from the audience? Yes, we have Ashley.
Hi. Yes, I just had a clarifying question. Two of you mentioned that you would call patients if they don't have access to come into the clinic, and where I'm from, that would be considered like telehealth. I don't know if that a billable service for you all, or is that just something when you have free time that you can reach out to those patients who are not able to come in?
Telehealth is the question, right?
Sorry, just say that. I
Telehealth.
didn't catch that.
Telehealth.
Yeah.
Dr. Vass, who's going to take it?
Would that be considered a visit? Like, are you able to block off time in your schedule saying, hey, I'm going to call this patient in lieu of a follow-up, and is that considered a billable visit, or is that just something you do as like admin work? That's my question.
Thank you.
Okay, I can answer that. Look, I think you can do it both ways. You are able to bill patients for telephonic consults via the insurance companies. But also, I know from my perspective, I just flag my patients on my computer that I actually want to follow up. And if I'm going to give them a quick call and say, how's it going with the medication, I'm certainly not going to bill them a telephonic consult for that.
Okay.
So you've got to individualize each phone call.
Thank you. Thank you. We have another question, the gentleman in the back.
Yeah. Thank you, colleagues. I'm interested to hear how you fill those gaps when, for whatever reason, in terms of affordability insurance, the patient can't have the access to a comprehensive service in the way that you might like them to have. What do you do to fill some of those gaps when patients aren't insured for aspects of care that you might want to offer, or indeed may not be able to be seen quite as frequently, for example, as you would like to see them? What do you do to try and overcome some of those potential gaps in their support?
Thank you. Dr. Ebanks, can you take that one? Or?
Yes, I could take a crack at it. I think the answer to that question lies in having a knowledge of what resources are available to you in the community. And also, you have to realize sometimes that, or many times, that although it's called a healthcare business, at the end of the day, the word care is the operative word in it, right? You have got to be concerned about your patient's care and their well-being and know what resources are available that they can access in order to achieve that optimal state of care. I know an everyday example that I will get a, an older person who is covered by Cynical who will come to see me in a consult, but I'll arrange all of their investigations through the HSA. You basically make use of the resources available to the patient.
Thank you. Susan?
Good evening, everyone, or afternoon. It seems with insurance that if you have a year when you're not very well and you have lots of tests, that next year your insurance goes up dramatically, but it never seems to come down again if you've had a healthy year and if you're doing all the right things like exercising and screening. I just wondered if we could consider how we can get the insurance companies to incentivize looking after ourselves, doing the right things, because certainly at my age, it just keeps going up, and you can have a really good few years, but it never comes back down again, no matter what you do. So they're not incentivizing. I get a no claims for my car. Can I please have a no claims for me?
Mr. Michael Gale from Cynical is here, but he's very quiet for some reason. He's not here. He's left the room. Okay. Yes. So the topic from Caymanians, locals, and expats, how does Cayman navigate personal health? And so talking about that issue of culture and nationality, I just want to ask Dr. Sidney to start with, how important is it for new health professionals who arrive in the Cayman Islands to receive a cultural awareness and sensitivity session or information prior to arriving or shortly after, in your view?
Oh, you're not making these questions easy, are you, Mr. Moderator? The cultural awareness, quite honestly, is at the very heart of being able to communicate effectively with your patient and to be able to serve their needs. You have to be cognizant of certain nuances, and that is what exists in every society, every community. There are nuanced communications. There are strongly held views on certain things. And I think it behooves you as a practitioner to get to know your people, as it were. In terms of how this should be delivered and whether this should be something of a compulsory nature, well, that's perhaps another conversation for another day. But certainly I do see the benefit of it, yes.
Okay, take it on the line then to Dr. Vass. Same question, your thoughts on it.
Yes, in an ideal world, whatever community or culture you're in, you'd understand more about that culture and community. But I think if you don't have the opportunity to have that kind of tuition, then I think doctors should be adept at listening to patients, and if you use open questions to patients and you don't you try to indoctrinate your patient with your point of view, you'll understand what their point of view is without needing to know any background. So I think in situations where I feel out of my depth in terms of cultural change, I just sit and listen, and therefore you won't make a mistake by assuming things.
Thank you. Tanushree.
I think I'm quite fortunate to have lived all over the place, and I've met people from many different backgrounds, and for me, yeah, I'm just used to a very diverse population. I think Cayman is definitely the most diverse place I've ever lived, and I think it's been excellent for like my from a medical point of view. Like, I think it's really interesting seeing at the end of the day, I think people are ultimately the same, but it's the differences, like, we have such a diverse population from like South America, North America, like Europe, everywhere, and I got to know very quickly the different like health beliefs, and you can tailor the consultations and to respect these health beliefs and just discuss the patient's concerns. So I think it's great. I'm used to change, so I'm not like, it's not been a big jump for me to come here and speak to people from like lots of different backgrounds. It's really good.
Dr. Rogers?
I'm pretty much the same. I've worked all over the world. I find dealing with different cultures is great. I see it as a positive challenge. And I find that the more I listen, the more I learn when it comes to different cultures.
Okay, we have another question. Oh, you have a question? Okay.
Hi, yes. I'm curious, what would it take for more expats specifically to prioritize seeking a GP when they come to the island, as they're coming up from a place that was once their home and now somewhere new? Many perhaps turn to therapy as a way to settle their minds with this recent change, perhaps as a trip to urgent care and a polite chat with one of our urgent care doctors to say, this is a relationship that's worthwhile building. What does it take for expats who are coming in, trying to find a new part of themselves to add to the community, to grow themselves, to say part of that growth really should be me finding a health coach, a GP, to work through this process of whole body health with me? What does that look like in your eyes, and have you seen an example of that playing out for you?
Thank you. Good question. Any takers? Dr. Vass, I'm going to assign you to answer first.
If I've understood you correctly, it's about us as practitioners. Would we engage with another practitioner for our own personal growth, medical, emotional?
What do you think should go through an expat's mind when they're moving to the island in regards to their whole body health that would help them say, I should really prioritize finding GP care?
I think it's very clear when you meet somebody, often within the first 30 seconds to a minute, whether you feel you can work with that person on a mental, physical, or emotional problem. So I think normally it's experimenting with who's around. I'd probably advise a patient or a colleague, don't choose a doctor or a therapist just by the fact it's somebody you happen to see first. I'd say shop around and meet a few different practitioners till you feel that click. Do you feel that practitioner listens to you and that you're heard by that practitioner?
What are the benefits of finding a practitioner and not, for instance, just knowing that I need an OBGYN, finding them and crossing off the rest?
Can you repeat that, sorry?
What are the benefits of finding and working with a GP rather than as a woman saying, all I need is an OBGYN and I'm covered?
If I heard the question correctly, I think GPs in this country are, I believe, slightly undervalued because there are a lot of specialists here. And I think patients in this healthcare system compared to the UK have direct access to specialists. In UK, a lot of problems would be sorted out and managed by a GP. And obviously I'm biased because I am a GP, but I think GPs do have a unique opportunity to see the whole person, to remember your OBGYN complaint, your skin complaint, your child's skin complaint. So I think I would encourage patients here and people here to see GPs as a resource of many specialities. And the benefit of having a GP is that they coordinate your care. They have your whole person in their mind and can better coordinate your care as well.
Do you see, the question, do you see any growth in the need in terms of aging of the population and other factors where patients are requiring advocates more now than they did, say, 10 years ago, advocate to represent them when they come to see a GP or when they come to get medical attention? Patient advocate.
I think, Mr. Moderator, this comes back to a point I raised earlier, which was about expectation and information and technological advancement. Obviously, as the population ages, you have to deal with more serious issues that arise as a function of aging, unfortunately. That's biology. We can't really get away from that. But we also have to now look at the interplay of what are the technological advancements available, what's the expectations, and what would be the role for an advocate for these individuals. I have a very strongly held view that I think it is very important, particularly in the cases of the elderly who are quite ill, that we identify an advocate for them, someone who acts as the bridge. Yet again, we see this evolving concept of bridging a gap, bridging the gap between the health system and the family. I think it's extremely important.
Thank you. I see your hand, but I want to, the minister and her chief officer have been here all day, and we really appreciate that. But I want to also give you an opportunity, if you or your chief officer want to ask any questions of this panel from Doctors Hospital and Integra. So after the next question, if you wish, I'll give you the option if you want it. Mr. Floyd?
Hi. I'm speaking from my personal experience as a general practitioner. I would like to pick up on what Dr. Ebanks said earlier about the need for health information and promotion and education. Because in my experience, people don't really seek medical attention unless they feel unwell. So a lot of these lifestyle illnesses such as obesity, hypertension, diabetes, they're simply not going to see the doctor. There are also some barriers to healthcare. Somebody touched on it earlier about the lack of coverage where health insurance is concerned. Some people also don't get time off their jobs to go to the doctor, and they have these chronic conditions that need to be managed. Doctors' offices are generally open at the same times as they have to work. So getting access to doctors after hours is difficult unless it's an urgent care setting. Some general practitioners are open on Saturdays for half the day, so then they might be able to go then, but some people also have to work on Saturdays for half the day or the full day. So access to healthcare is a problem, even though we have so many doctors on the island. Still getting access is difficult because people don't get time off. In addition to that, the question about follow-up, and I'm really glad that you asked that question. If someone, for instance, has a chronic condition like hypertension or diabetes that's not necessarily causing them any symptoms or causing them to feel unwell, they'll just want to come and see you once, get 12 months of refills, go on their way, because they know that their health insurance is not going to cover probably more than 1 or 2 visits to the doctor for the. If they're referred for investigations like blood tests, they're not going to go because they'll have to pay out of pocket. Some health insurance policies won't cover that either, their labs. And it becomes, I suppose, a problem where there's inequity. There's inequity in healthcare because those that can afford it will go, get their things done, come back and see you when you schedule your follow-up. And those that can't afford it will disappear until they've run out of medication. So it's a really complex problem. And because we're talking about locals, expats, and so forth, you also have to take into consideration the cultural differences. Some people that live here come from countries where they can just buy medication over the counter. They don't even need a prescription. Or they'll just get their family to send it to them from, by DHL or whatever. Some places, some persons that live here would prefer to take bush medicine, and they're not interested in what you're offering them because that's not the cultural norm where they come from. So it's really important, as Dr. Vass said, to take a holistic approach to your patients, even if it means an extra 5 minutes on a really busy day in your practice. Just take the time to find out about that person, not just about their hypertension or their diabetes. Who are they? Where do they come from? What do they do for a living? Do they have children? What are their social circumstances? What is their pay? Are they able to afford health care if they don't have the health insurance? Or are they just basically scraping by, which a huge proportion of our population, they are just kind of managing to get by. The cost of living here is very high. Thank God they're reviewing the minimum wage. Because a lot of people are suffering here. They're just trying to survive. So they're not really prioritizing a health condition that's not causing them any problems. And hence we have the problem, with complications developing, because after years and years of not being proactive about your health care, you then run into complications. So it's a really complex beast, and we need to address it. But that's just my 2 cents.
We're almost out of time, but I'll allow one further question before I defer to the Minister or Chief Officer for any thoughts. So, the lady in Irish green.
Good afternoon, everyone. really appreciate all the comments that Dr. Lloyd just said. We have a lot of patients who come who are not insured, and we do a variety of things to help them, including asking them to get blood tests when they go back to their home countries, including advising them to fly to another jurisdiction to get certain tests, including charging them, a rate that's totally non-insured. And we know that some of that may never come back. But that's what you have to do because, it's healthcare, and there's always going to be a small proportion of people who can't afford, and you're still going to get the people who have a health insurance. So I think every practice should bear that in mind, that they are going to have patients who can't pay at all. And
Absolutely.
just, suck it up. It's part of what you do. In the old days, people came and paid with, conch shells, conch and all sorts of lovely products, and that was acceptable and quite normal.
Times have changed, yeah.
Yeah.
Thank you.
My final comment would just be for a shout out to general practice in terms of patient and practitioner, is that they hold the sort of strings to the rest of your healthcare in a holistic way. So if you always, like this lady said, go to your to a gynecologist. A gynecologist is a specialist, but you have other needs as well. And I think it's really good to have general practice as a foundation, and from that you build, and it actually saves healthcare costs, because if every time you go to a specialist, that's a lot more expensive, and half the time you don't need to go there anyway. So I think if the government, and I discussed this earlier on, had a model that general practice is the foundation on which other things are built, then you sort of go upwards with a pyramid instead of a broad pyramid at the top working downwards, which is currently what we've got.
Thank you. Thank you. I'm going to allow a very brief response from the panelists, 30 seconds each, and then I'll defer to the Minister or Chief Officer for final thoughts. So starting with you, Dr. Ebanks.
Thank you very much, Mr. Moderator. I'd just like to thank Drs. Hobday and Lochloy for that overview. It's very important that we bear that in mind, and we have to care about people. It's that simple.
Thank you. Dr. Vass, 30 seconds.
Yes, I just reiterate what Dr. Hobday said before. We're all biased because we're all GPs. We do see ourselves as the first port of call for most health problems, and we enjoy being we enjoy the relationship of working with a patient towards their health goals. Come back GPs.
Thank you. Dr. Tanushree.
Yeah, I'm all about general practice. I think it's the most difficult specialty, and I think finally I am able to. Previously, I felt like I was firefighting and just not able to make any sort of difference, but I feel like I'm able to spend the time and get to know patients and, build a relationship with them, and, yeah. So.
Thank you. Last but not least, Dr. Rogers, 30 seconds.
I think they've all said exactly what I was going to say. So yeah, I think we just got to continue being the gatekeepers and trying our best to promote holistic health.
Thank you. Now to the Minister or Chief Officer for any question or comment or any reassurance you want to give to the audience.
Thank you very much for the opportunity, and thank you, Minister, for me to answer. But I just wanted to thank all of our presenters so far that we've had to date. It's been very thought-provoking, a lot of good, useful information that we all need. As we talk, as we listen more, we know that we're in the right space in terms of our thinking and getting this conference out more to our community and having our people be able to access the necessary information. When we look at what our stats were in 2012 and where we're at in 2023, that alone tells us that we have to make sure that the persons out there in the public domain get the necessary information. And that's one part of it. The other part is also for us to take away what we need to do from conferences like this and have our action points and be able to actually have something that is happening in our communities to show the difference that we're making. So it's great. You're always inspired when you come to these type of events because there's like so many things that we can do. And I'm sorry, I'm trying to not put my back to other people here. But there's so many things, but then that falls away sometimes. So how do we prioritize that? One of the things that we want to do at the ministry is have more public engagement. So as we look at our topic today, bridging the gap between patient and practitioner, we also want to bridge that gap between public and private. And how do we have more collaboration with our private sectors that we can then get to where we need to be? Because it cannot be government alone. I think that, you know, experience has shown that over and over, even in terms of when we come to this type of setting, that we're saying, well, okay, if we are expected then to just go back and do these policies and so forth, how are we going to make these policies in isolation? We need to be able to have more partnership. So there's lots of ideas. There's a lot of catch-up stuff happening at the ministry that bridges 10 years of stuff. And so a lot of it's compounding. Our healthcare has grown so rapidly that we're trying also to catch up with that. And what are the technological advancements we also need to put in place, that we have better automated processes and that we are supporting business and not causing that to drag for the things that we need to solve some of the issues that we have currently. So there's a lot happening behind the scenes. We're not seeing that just yet, but we're looking out to be able to report better by next conference for sure, and take away some items from here, from this conference, and how we can get more involvement. We've talked about having a health summit that speaks to having engagement with the various practitioner types and various aspects of how we look at the whole person care. So those things are in the thought process. Minister is very passionate about public health. We see public health as bridging that gap, as looking at the whole person as well. And she's also spoke to us a lot about not only just public health, but how do we be able to look at, she talks a lot about data. We've seen some of that coming to fruition, and so we're very happy about that, because that is what helps us to be able to know how do we go forward. So there's quite a bit happening. Like I said, we do need to do the National Health Strategic Plan. That will depend on all of us that live in these islands being able to speak to what we want or need healthcare to be and how can we get there. So that sort of thought-provoking stuff is very exciting from a minister's standpoint for me. And I'm sure Minister, you know, if she has anything to add. But thank you for the opportunity, and we'll certainly hear more from us in, you know, as we go forward.
Thank you very much, Chief Officer. And I know, as usual, Minister Turner has been making her notes and will have quite a bit to say as she closes up the conference tomorrow. I'd like to thank Mr. Ebanks for giving me a reprieve, and the doctors from Doctors Hospital and Integra for this insightful panel. And we know this discussion can go on for hours and hours, but we want to get you out of here this evening because we look forward to having you back with us tomorrow morning. We have breakfast at 8:15. It's sponsored by Aetna, so come, get your bodies nourished for a half day of discussions on important health matters as we look to bridge the gap. Thank you very much. We look forward to seeing you tomorrow.